Welcome to the Perfect Place to Put a Practice podcast by Scott McDonald and DrDemographics.com, the best source of demographic, psychographic, and marketing information for professionals.
This episode of the Dr. Demographics podcast is brought to you by ConvertSocial.ai. For the past several years, ConvertSocial.ai has helped us post and promote this very podcast. Likely many of you found it and are listening to it due to the great work of the team at ConvertSocial.ai. Look, let's be honest. Most doctors struggle with staying consistent with their social media. They always start with great intentions, but things get busy and the social media for the practice gets forgotten. ConvertSocial.ai solves that consistency problem, and they do it at a price that's likely less than you're paying for Post-it notes each month for your office. Do yourself a favor. Solve your social media problems by going to ConvertSocial.ai and let them know that Dr. Demographics sent you. That's ConvertSocial.ai.
Hello, this is Scott McDonald of Dr. Demographics, and I am here to share with you some interesting stuff that is not quite as demographic oriented as much as it is communications oriented. Now, as you know, I'm a professor of communication. And what I'm doing is applying theories that are appropriate for healthcare. Today I'm going to be talking about agenda setting and framing. And I hope you'll find this interesting because I find it fascinating. So how do you win arguments? How do you get people to like coming to your practice? How do you create a contrast between you and other practices? Now, like I said, you probably know I'm a communications professor and that I specialize in market research for healthcare practices in the course of my work. I cover some important theories of persuasion that I think you'll find interesting. Now remember, the idea is we're trying to persuade people to come into your practice. What will it take to make them your patients? And today I'm talking about two theories. One is called framing and the other is called agenda setting. No matter what kind of practice you have, there is a way to sculpt public opinion in your favor through a marketing plan. Now, there are two primary ways to do this. The first is called framing and the second is called agenda setting. They are not the same thing. It suggests that the way we present something to our target audience, called the frame, will influence how they think about that information. This is fundamental to how persuasive you can be, but you have to understand, to do this, you have to understand who your target market really is, and that's where the market research comes. Now, you may remember how we used to speak about estate taxes. Now, the name is right, it is accurate, but it didn't particularly move the needle on persuasion. The term death taxes was much more effective in changing public opinion. And this is an example of framing theory. In healthcare, we used to describe eye surgery, for example, which makes everybody wince every time you mention it, that we changed the term into LASIK surgery. It's effectively the same thing. But the way that we frame it, the way that people are told about it, is importantly different. Now, we've used this theory to describe several procedures to do with several rather dramatic things in cosmetic surgery. And sometimes we refer to this as a mommy makeover. It's mostly done with the help of surgeons who have gained public acceptance. Now, the procedures are the same, but they have a much greater acceptance by the target patient base, since the name of the procedures have changed to imply, well, the benefits that go along with it. In this way, framing has made a real benefit to everyone involved in building the practice identity and trying to promote patients to get services that they genuinely need. Now, let's talk about what framing theory is. Framing theory is a concept first put forward by Irving Goffman. It suggests that the way we present something to our audience, called the frame, influence what they think about that information. You may be familiar with Frank Luntz. He's a Republican strategist who named global warming as a much more benign climate change. Framing is the careful choice of rhetorical devices to influence a certain meaning, and that makes it a much more, also more persuasive theory as well. In direct-to-consumer advertising, and they sometimes refer to that as DTCA, was illegal in some countries. In the United States, it's not. Prescription judge referral is allowed in the United States, but only a few other countries allow it. In most countries, it is banned because they assume that people cannot understand pharmaceutical references. It relies primarily on PR to publicize the products. An analysis of press releases used by pharma companies in Israel, for example, where DTCA is banned, found their content predominantly used third-party influencers, such as leading experts and physicians to frame the message as credible and the drugs as heroes. Conversely, the message about also villainizes the diseases and used negative framing of patients as a ticking time bomb. In the United States, we have something else. Now, I'm not trying to say that Israel is wrong or that other countries are mistaken, but I think the outcomes are actually pretty good. Now, as doctors, we don't dictate what people are supposed to think about. Rather, we use these theories like framing to tell the public how to think about things, like your practice and the procedures you offer. Dental implants, for example, were not universally accepted when they were first presented as an alternative to dentures. I have some background in the early days of dental implants and the development, but as they gained traction among professionals and the costs and risks of failure were reduced, they became universally accepted as a viable option. This is the path a significant number of procedures that your practice may do, and framing theory is the communication tool used for that purpose. Now, other governments have said people don't know enough to avoid being trapped in referrals by experts and testimonials. But we have found actually people are much smarter than they think when it comes to their health care. Now, agenda setting theory developed by McCombs and Shaw in 1972 states that the media have a large influence on audiences by choosing which stories to make prominent, thus influencing what publics should think about, known as the first level agenda setting. You see, the media also uses selective attributes to shape the stories, influencing publics in how to think about them. In the vaccines that were put up to solve the problem of COVID-19, we had the government involved heavily in agenda setting. Thus, the theory says that media determines for the public what is important and why. And actually, alternative media, advertising, film, entertainment, TV, and music may have a greater effect, in fact, than the news media. But no matter the conduit or the content is no longer user created, there is always a gatekeeper author that controls the story that sets the agenda for your audience. Think Twitter. Twitter has been acting as a gatekeeper. It eventually made people want to get the vaccines, and the federal government was just fine allowing that to happen. Now, I want to talk to you for a second about message control of your practice and marketing reports. Dr. Demographics looks at a large number of factors about a practice site and the practice area to advise our clients whether a site is desirable and viable, then how to attract patients to the office. Our purpose is really to get them in the offices of good, credible doctors, and we expect the doctors to communicate the benefits and features of these procedures. But we also do market research to advise our patients or our clients on messages that are appropriate for his or her patient base. We call that psychographics. It's also known as a lifestyle study. To make that determination, you see, in the end, we want the theories of framing and agenda setting to move the needle for the practice population. In other words, if it's good for them, and we believe that the doctor will help them make that decision, you have to make the needle move in advertising and public relations activities. Even established practices benefit from this kind of research. Lifestyle analysis, well, we call psychographics, is presented in our marketing report for geographic areas that we are studying. So we can tell you not only how many people there are in that area, and of course practices offering those services, but we can also say what the lifestyle motivations are, the values that people have, to get those procedures. To give you an example, take a look at our website at www.drdemographics.com and take a look at the marketing reports to see what we mean. Now, as an aside, I provide some information about psychographics in last week's episode. But the idea is the same. You have to know what makes people go, what makes people buy or not buy, and the psychographics will provide a definitive, logical, and scientific way to determine what is happening in people's lives. Now, message control is important. We usually have a sufficient research when we do a marketing report to offer creative, and this is another word for advertising and public relations copy, that applies to this practice. This is the basis for future practice promotions. So if we know enough about the area and the people living and working in your area, we can make recommendations, say this would be a good strategy to get people to come into your office. And you should know I'm a big believer in market research. But it should be clear that we must discuss the scope and use of any message or content for the practice before it's generated, before we put something into use. A one-size-fits-all strategy is a really bad one. We would be creating a unique document based on research that would require reworking and editing, but would put the practice on track for serious growth with its use. Now, I am the first to say there are companies that are unethical that use psychographics or assume that certain things are going to be true what you tell the public to get them to act. I'm very cautious. Our team knows what it's doing, and we can tell you what your likely results will be. Marketing should always remain the property of the practice. Sure, we can generate it, but you have to, well, make it specific to the practice and to the people who live and work in it. This research is not expensive, but its use in practice promotion is invaluable, and the findings are proprietary. In short, if it works, you're the one who will know it because you'll have the answers. It is a useful tool in site evaluation, practice promotion, and publicity. Framing and agenda setting are extremely useful tools in formulating what you want to say about your practice to build a motivated and loyal patient base. That's why it exists. Now, I always say that there are some big questions for demographers. Whom do you want to serve? In short, who is your target audience? Second, how do you move the needle of action? How do you do something other than just put a message out there and hope? What do you need to know in order to make this work? Now, Mike Green is an expert in this psychographics, and I really recommend you talk about the results that you get. Now, we offer these psychographics in the Quick View report, the Market Site Viability report, and the Marketing report. You can see samples of what we do, as well as prices in the drop-down menu. The idea is to give you enough information that you can make wise and prudent decisions about promoting your practice and getting people in the door.